Welcome back to Trending in Education. Dan Strafford, Michael Palmer along with you on this episode. And today we're going to talk about the world of nursing, the world of healthcare education with a great guest. But before that, always like to check in. Mike, how you doing?
I'm doing good, Dan. Thanks. Thank you for asking. Had a nice weekend, and then we're lucky enough to be joined by a guest. We have a guest star here with us, and our regular star, Brandon, unfortunately is unavailable. But we're really happy and excited to have Dr. Susan Sanders here with us, Vice President of Nursing at Kaplan Test Prep. So welcome to the show, Susan.
Thanks, Mike. Glad to be here.
Yeah, happy to have you, and happy to sort of pick your brain about what's going on in healthcare education, nursing education, sort of the professional world of helping people. Can you let our listeners know a little bit about your background? Because you've worn quite a few different hats over the course of your career, all of them really in the nursing and healthcare space.
Right. It's really an exciting profession to be in because there are so many opportunities. When I first got out of nursing school, I went to a hospital to work, which was typical.
Mm-hmm.
And I worked as a medical surgical nurse and then moved on into critical care and emergency.
Mm-hmm.
So as a clinical nurse, my specialty is critical care and emergency.
Mm-hmm.
From that, I also have had the experience to be a consultant for hospital operations. I've been a chief nurse in a hospital a couple of times, which means that I'm responsible for all of the nurses and the patient care that's occurring in the hospital.
Mm-hmm.
I also then have been a director of a nursing program, so involved in not only nursing education, but the business aspect, plus the clinical aspect. So all that to say that I have a lot of experience in nursing, and that means I'm old, right?
But with a wide depth of experience, a wide depth, I don't know if that's a thing, but a lot of width and depth to your experience. But lots of times these days, folks are trying to build teams that are diverse. And in part, that's because a team with diversity in it is going to have very different perspectives. Your career has such diversity within nursing that you're able to bring real depth of experience to understand all the different angles that exist within delivery of care. Out of all of those things, and that doesn't even touch on your experience now within the educational space too, right? So, there was the more practicing aspect of your nursing career,
Right.
and then you sort of evolved into the nurse educator space. Can you talk to us a little bit about what that's been like?
Well, sure. Nursing education is several components, of course. So there's the didactic education, which is the classroom teaching, which, I can stand and lecture about trauma nursing and emergency nursing and talk about a lot of different treatments and how to take care of that type of patient. But then we also move in nursing education to that clinical hands-on
Yep.
teaching. And that's what we would call clinical experience. And then we also have laboratory experience where I would practice giving my shots in the lab before I would actually go and provide that to a client or to a patient in the hospital setting or whatever clinical setting.
Mm-hmm.
So when I think about all of those combined, it really is a strong and rich part of education. So
Mm-hmm.
they're learning the content, then they're practicing it. And when we're preparing nurses to practice, we have to provide them with many experiences. And when you go to a hospital setting, if you're on a clinical unit and there's 5 students, everybody doesn't get the same experience.
Mm-hmm.
So that's part of the reason why I think that simulation and virtual and augmented reality are going to be a really important part of
Right.
what we're looking at when we're talking about education.
Mm-hmm.
So as an educator, I've done a little bit of it all. I've accompanied students to the clinical setting. I've watched them take care of the clients. I've also been in the labs with them.
Yeah.
So it's been a really, really rewarding also educational experience.
Yeah, I imagine. And getting back to my previous point, like the wide range of like real life experiences that you had prior to focusing more on the educational ones, I imagine make you a much better educator than if it was purely didactic and only things you had learned in school. In some ways, that doesn't even make sense so much for healthcare education, where like you're actually
Right.
going to become a practitioner. You want to be educated by people who actually know what it's like to practice.
I think you have to be. I think you have to have someone that has actually done the procedure or been in the setting so that they can bring not only the knowledge but the experience and the information to share with the students, or or with others. When I teach students, I can say that I'm there's a range of expertise in nursing.
Mhm.
New students, new grads come out as novices. As you have your experiences, you become an expert. So
Mhm.
I'm an expert nurse in critical care or emergency. So if I'm walking by a patient's room and I can look in the room and I can pretty much figure out what's going on with that patient just by looking at them.
Right.
But a new nurse needs to actually walk in the room to the bedside and assess what's going on. They
Mhm.
have to really bring forward all of that information. So what I bring, what any educator brings to the student, is that wealth of experience.
Mhm. And I imagine that with new techniques are emerging to sort of tap into that experience and also provide the learner with a better sense of what it might feel like even before they're in a hospital. So that's part of the idea of the simulations, but even sort of the curriculum itself, I imagine, is trying to get nurses to envision themselves in the role of a practicing nurse well before they're sort of finished with their nursing education. Like in some ways, you're trying to get people to be able to imagine themselves delivering the care, and assessing how they would respond to novel or sort of slightly different scenarios than maybe what they had been trained in.
Well, and every situation could be different.
Mm-hmm.
And how you respond in that situation is going to be what's really an important piece to that.
Yeah.
So that and we can't teach every experience. You have to have that critical thinking, that clinical judgment as a nurse to be able to respond to whatever's going on.
Right, right. And that's where some of the new media capabilities and some of the even like older modes come into play as well. So like as someone progresses further through their nursing education, or really pretty much any healthcare role, I would imagine, you begin to move maybe out of that didactic phase and more into sort of simulations and even sort of shoulder surfing or following around a practitioner to kind of be in the actual physical context of delivering the care.
Yes.
Can you explain to us a little bit about what that's like, or what your experience of getting more and more practical and applied, what that's been like, and then also how maybe that whole field has been changing in, say, like the last 10, 15 years with the advent of digital delivery, digital healthcare, all those sorts of things?
Well, sure. Healthcare changes dramatically year over year.
Mm-hmm.
So, at the beginning of education, my experience was with static mannequins in a lab. And now we've moved to the ability to have, m- you know, mannequins in the lab that can respond, they breathe, they blink their eyes, they actually respond to what the nursing student is doing, performing on them.
They're almost like robots.
It's kind of creepy, freaky that they can respond in that way. The technology is just pretty amazing. The difficulty with those types of scenarios and labs is that the mannequins are extremely expensive, and you still need a faculty, a nurse faculty to administer the responses and to be there to observe the students and to guide them. Now, as we move to digital and to virtual simulation on a computer, you actually can build those responses in as a nurse expert, and then the student can do that virtual simulation wherever they are, whether they're at home. There's not the expensive mannequin. There's not a faculty looking over their shoulder. Now they're going to get feedback from what is already programmed into the scenario, but they really are on their own. And it gives the students all the same experience too. I said, if there's 5 students on a unit, they're not all going to get the same patient, so it's going to be different. But in this case, we can be sure that every student gets a standard experience.
Right. And historically, it's been, even in parallel to those mannequins, there have been simulated patients, right?
Yes, where you can hire an actor to come in and perform like a patient.
Yes. And this is, for me as a layperson with relatively good pop culture knowledge, this is where the Kramer episode of Seinfeld comes to play, where I think like a milk dud of some kind, there's like an observation gallery. Kramer, who was a simulated patient, accidentally drops a milk dud into a surgical theater, I think, actually. But a lot of people understand that reference, and it is kind of funny to think how when humans had to solve this problem, it almost lends itself to a sitcom. I think it's still maybe funny depending on how you want to solve it today, because like when you try to do it with a mannequin, there's some comic scenarios that could evolve around what's it like to deal with a mannequin, and I imagine even in the AR VR scenarios, there are probably some amusing angles that may emerge there. But I always come back to the idea of Kramer. Was that accurate? Was that a pretty fair assessment of what it was like to deal with a simulated patient back in the day? I think
it could be, and it could have happened in many different ways. It really, I think Kramer is not totally an oddity, but he is definitely odd.
Yeah. But the interesting angle, though, too, in reality, is pretty much every patient is going to be kind of quirky and unique in his or her own way. And that's why, even though it is sort of a comic example, I imagine comic examples walk into an ER more often. That might be another podcast, in fact. Like, I'd love to get some of your war stories from back in the day.
We definitely have a running list of interesting cases for sure. And the other part of that is when we build these cases, whether it is through a simulated patient or whether it is digital, we have to include different personalities, because every patient is not going to be compliant. Every patient is not going to be happy to see me.
Right.
They're going to be grouchy. They don't feel well. There's a lot of things to build in there.
Yeah.
So I think that's a really important aspect, is that we have to be building in the realistic.
And the social emotional aspect too, which is obviously, a lot to talk about there. Dan, I think you wanted to get in a little too, right?
Well, I think I have a good friend in New York who does the patient simulations. She's an actress and has been hired many times out. But Susan, I wonder if the technology here levels the playing field for those in rural settings or for nurses who are not at major metropolitan, universities because there aren't actors or simulated actors at all of these places. Does the technology and the availability of it, whether AR, VR, or even just technology of online learning, help spread the education sense here in nursing and in medicine?
Totally does, especially when you think about the specialties. So, I live in rural Tennessee, and I worked at a college, and the predominant diagnosis for our clients in our area were heart disease or diabetes. But to get an interesting case of a pediatric case, that would be shipped off to a larger city. So students that are in a smaller rural setting may never have the opportunity to see that case.
Mm-hmm.
The same way with obstetric deliveries. A student may go to the hospital for their obstetric rotation and be there 12 hours, 3 or 4 days, and still not see a delivery.
Right.
And therefore, you've got to provide that clinical experience for all students, because they're all going to take the same licensure exam and need that same experience for their practice.
Right.
So it's huge to have some type of standardized patient, some types of simulated patients, something along those lines.
Mm-hmm. And there's been, oh, go ahead, Dan.
Sorry, the other question I had was around time. Obviously, nursing students, medical students are very busy. And one of the articles we had was a New York Times article talking about where medicine education is, and talked about a 360 virtual reality experience where a 45-minute procedure was cut down to 5 minutes, 30 seconds. And how important is it that instead of standing over or being Kramer in the gallery watching, how important is it to cut down the amount of time needed to provide this educational experience?
It's huge. Most nursing students, and I doubt that medical students also have an outside job, but most nursing students have some sort of employment, part-time, or some of them even full-time, if their finances require that. And therefore, they're always looking for ways to fit more in to their time for study. And so being able to condense the salient points, the important features of whatever the experience is truly an important piece of the education.
Yeah, and it's a place where technology really can be a leveler and can provide greater access to what used to be, scarce and highly specialized. Now, if you have the time and the inclination, you can actually lean into experiences that used to only be limited to, maybe a medical school that's specializing in a particular field. Now, a lot of those assets there are assets that are captured within that context that are then available for learners who may be far afield, maybe even international. And I know in your experience, you deal with learners really all across the globe. And can you talk a little bit about what that's been like just over your experience, starting to get wider and wider exposure to the types of folks who are interested in healthcare education, nursing education?
Sure. Well, nursing education in the United States is definitely different than international education because of the requirements. There's a licensure exam in the United States, and we have international nurses that want to come to the United States. Therefore, we have to be sure that their education is standardized. And so we've had the opportunity through Kaplan to actually provide education to international nurses, as well as testing for those international nurses. Because, for instance, students that perhaps are in the UK don't have as much experience in obstetrics and pediatrics and psychiatric nursing. So there's an opportunity to provide lectures, content via digital for those students. And then there is the opportunity to provide virtual simulation clinical experiences to them so that they can reach the standard that's needed in order to be licensed in the States,
Yep.
just like a nurse educated in the United States.
And a lot of that is speaking to how career pathways into healthcare are changing in all sorts of ways, and new like relevant career paths are emerging that really haven't existed before, and the way in which care is delivered is evolving. Can you talk a little bit about how you've seen those changes?
For sure, especially as healthcare providers, nurse practitioners in the United States are really augmenting that first line access to care,
Mm-hmm.
and with that, then we have other countries, other international nurses who want to be nurse practitioners, and therefore they have to come to the U.S. for that education. They have to be licensed as nurses to begin with before they can even get in on the graduate education. So there's a need for not only licensure if they want to practice as a nurse, but also if they want to go to graduate school to become a nurse practitioner.
Mm-hmm.
And there's a lot of opportunity for that graduate nursing education to be delivered digitally,
Right.
whether it's through the lectures, through the testing, or through the virtual simulation field.
And I imagine that's true, that the virtual helps for folks in that context, but also for a career nurse who maybe got his or her education 10, 20 years ago. If you want to stay current and you want to stay up to date in terms of how healthcare is changing and how the world is changing, I imagine digital simulations and otherwise, but just having access to the type of curricula that you've been working on really throughout your career, your educational career at least, I imagine that the digital access to those assets are really valuable for a nurse 10, 20, 15 years into their career. Is that relevant?
It is relevant because lifelong learning is a really important part of nursing education. I have to tell you, this is my 40th year as a registered nurse.
Wow. Yeah.
Things have changed
imagine.
in 40 years. Therefore, I've had to stay current through coursework, conferences, but providing continuing education online is a huge component. And as a matter of fact, my doctorate in nursing was through a primarily and predominantly online program,
Mm-hmm.
because I could take my courses online and then meet with my professors in person at certain times during the education. But education and practice have certainly evolved into a lot of different technologies
Yep.
that are available.
And some of them are allowing nurses to connect with other nurses more too, which is an interesting trend, like the social aspect. And we were talking a little bit during our prep about how the Gallup poll every year to see which professions are the most trusted, pretty much uniformly, the number one most trusted occupation is nursing. And when you combine that with the fact that nurses now have new ways to stay connected to the community of caregivers, that's exciting, because then that actually allows these trusted professionals to begin to leverage the emerging capabilities to kind of share knowledge and provide support to each other. Any thoughts on the history of that Gallup poll and the role of nurses in sort of the we talk about the zeitgeist, the idea that like it is a profession, it is an institution that folks do trust and really seek out really in their times of need.
Well, and I think that trust is built on the knowledge that nurses have a wealth of background information and knowledge about patient care and health care. And it's not only the physical, it's the caring aspect, it's the psychological aspect, so that not only does the nurse appear as that trusted, knowledgeable professional, they are also the caring professional. And I can't tell you how many times people that I meet, just random on the street, at the airport, at the grocery store, and we talk, and they'll say, "And what do you do?" And I always lead off with, "Well, I'm a nurse."
Mm-hmm.
Now, I'm a nurse educator.
Sure.
I help write nursing exams and develop products, but I'm still a nurse at heart and in practice. And that's always met with usually a story about how a nurse has really touched
Mm-hmm.
that person or their family's lives.
Yeah.
And you have people calling you all the time at home saying, "Okay, my child fell off the swing, and what should I do for them?"
Yeah.
So it's all based on that knowing that I have the knowledge and the compassion
Mm-hmm.
to care for them. So I think I love that the Gallup poll does that, and every year nurses just rise to the top.
Yeah, and in a very personal way too. Like, so when you were talking there, I was thinking, like, Dan and I are going to hold on to you afterwards and just ask for some private consultation while we have you. But it does tie to another concept that we talk about a lot on the show, which is social and emotional learning. And folks who are drawn to the nursing profession, I think, frequently have some innate ability to give care and a desire to do it. But I imagine some aspects of this are teachable too. Like, in addition to the more cognitive components, there are non-cognitive components to really being a good caregiver, a good practitioner in healthcare. Are there any examples of that you think are relevant to this conversation?
Yeah, I do. I think that the communication piece is a really important part of that. As a nurse educator and taking nursing students to the clinical setting for the very first time, the hardest thing is getting the student into the room to talk to the patient,
Mm-hmm.
because they're nervous. They don't know what to say. Many times they may be 20-year-olds trying to talk to an 80-year-old.
Mm-hmm.
So it's really, I think the communication, and in nursing we call it therapeutic communication. It's how do you listen and how do you respond so that you can benefit your client in a better way.
Mm-hmm.
So I think that's an important piece of it. And again, I keep thinking back to simulation. There are ways now within digital simulation to have a conversation
Mm-hmm.
with the patient in that setting, and therefore you can practice your responses, and then your client will give you responses back, whether they're good or bad. It gives you the opportunity to practice that communication. So it's not only the knowledge of how do I start this IV, what is this medication for, but how do I interact with this client?
Yeah.
And I use client and patient interchangeably.
Sure.
That's kind of how the nursing world is, but that's how I would respond to you as a patient or client back to me is a really important aspect.
And based on the Gallup poll, maybe other professions would benefit from similar training to understand that sort of therapeutic mode and that, care-based active listening that is really fundamental to being an effective nurse. But maybe the rest of us really would benefit from more of that. Dan, I think you had a follow-up as well, right?
Yeah, Susan, from a social emotional learning perspective, and I have to credit my wife for educating me on this, something I've read a lot about is compassion fatigue. And the nursing industry, teachers, emergency response people are often dubbed as most susceptible to compassion fatigue, which basically means you are so compassionate towards other people that you eventually lose self-care. You take on a lot of that. That's been a big educational push for teachers. Has it been a big educational push for nursing students and the idea of teaching the whole nurse, the self-care, the therapeutic care you're talking about, and really making sure there's self-care involved in their education as well?
It's a really important topic, and it is brought up, and it's really noticeable in hospital settings particularly, you'll see, and in nursing we call it burnout. You really get burned out in caring for the client because, again, your focus is outward.
Mm-hmm.
And so we talk to our students about caring for yourself, and caring for yourself on a 12-hour shift when you're caring for 5 or 6 patients. That means taking a break. That means having lunch.
Mm-hmm.
That means stopping to go to the bathroom. I mean, there's a lot that needs to be done, not only physically, but also emotionally as well. And emotional intelligence is a really key component to being a good nurse, I believe,
Mm-hmm.
because you need to know yourself and you need to know how to care for yourself in order for you to be able to care for the others. One of the things that I think that helps burnout for nurses is the variety of opportunities we have. Because if you're burned out as an emergency nurse, then maybe you need to seek out a new or different type of nursing. And those are readily available. It's really good.
Mm-hmm. That's like help the whole nurse, but they're helping the whole patient, but and I imagine there's a lot of experience that we impart to our customers and our own the folks who are going through our Kaplan's nursing program around self-care and social emotional health and all those kinds of things, which I think is hugely important. We're coming up a little bit close to the end of our time with you. One of the questions we typically like to ask our guests towards the end is, what are some new trends that are emerging that are catching your attention that you think might be relevant to our listeners? And they could be related to your field, they could be unrelated to your field, but we're a trend spotting show, and we'd love to hear when we have talent like yourself available to us. We'd love to hear what you're noticing. Anything new emerging? Anything sort of got your curiosity and attention these days?
Well, related to education, healthcare education, there's a lot of literature, a lot of research, and a lot of movement toward collaborative learning. And that means collaborative between physicians, nurses, pharmacists, allied health, respiratory therapy, a lot more of the holistic patient care learning that we see, so that you'll see simulations that involve the team.
Right.
And so we see a lot of that. We see a lot of, in nursing education, active learning principles, so that instead of me standing in front of a classroom and lecturing, I'm bringing examples and case scenarios into the setting so that students can become involved with the thinking and the interacting. And the other thing that we see coming around the bend is the National Council for State Boards of Nursing, who set the licensure exam for nurses, is talking about a major change in the licensing exam for nurses coming about 2022, 2023.
Okay.
And it relates to that same case scenario. How do you take care of the patient? Not just what's the lab work, what's the medication, but the holistic, how am I going to care for this patient and client?
Got it. Fascinating stuff. Any final thoughts, Dan, from your side?
I think this is a conversation that we could probably have for multiple hours with the depth and breadth of your experiences, and greatly appreciate it. Mike, any final thoughts before we close out the show?
No, I just really appreciate getting Susan on the show. Brandon does send his regrets. He would have loved to have been here. We'd love to have you back, too, to dig into some of these topics in some more depth. But thanks very much, Susan, for joining us.
Thanks for having me. And I could talk about nursing for a long time.
And I have a feeling people would listen. So let's follow up on that. Yeah.
Susan, anywhere that folks can find out more about yourself or where you teach or what your focus is right now?
Well, we have our Kaplan Nursing website, and there'll be information, podcasts, white papers, those kinds of things. We have a nurse educator's website that they could find at Kaplan Nursing. And then I actually still teach an online class for graduate nurse practitioners at a university in Tennessee. So lots of things going on with me.
That's fantastic, and you'll hear Susan's voice across multiple things at Kaplan. You can check out Kaplan's nursing YouTube channel as well. Learn more about Susan therein. So a great guest, and look forward to having you again in the future. You can find us on Twitter at Trending in Ed, same on Facebook, over on iTunes, Stitcher, TuneIn. Don't forget to leave a rating, leave a comment, and share us with a friend. With that said, we'll be back next week with a brand new episode of Trending in Education.